All right. Well, thanks for joining us this week. I have a very special guest on, Dr. Silvers. She trained at Mass General and Brigham's and Women's Hospital and did her ER residency there. And Dr. Silvers, thanks for agreeing to talk to us today.
Oh, it's my pleasure. Thank you for having me.
So, as a physician, a lot of us have grown a little bit tired of what we do and are looking for a way to transition out of full-time clinical medicine. And so I'd like to just talk a little bit about your initial practice after residency and how you felt as you got out into the trenches of hands-on patient care.
Sure. Well, I always knew during residency that I wanted to work part-time afterwards, and that went really against the general trend of thinking at an academic place such as Mass General and the Brigham. But I just felt like I wanted to devote as much attention to my family as I did to my career. So I always had this plan to work part-time.
Okay. And so I've read a few of your articles, and it talked about how you had, with the birth of your child, went on maternity leave and then made the decision to come back. Was there sort of a transition period where you prepared to not come back, or is it something that just sort of was a matter of circumstances all aligning, if you will?
Well, I'll tell you that when I went on maternity leave with my third child, I had full intention of going back after the 3 months, just as I had after my first two maternity leaves. But even before the maternity leave started, I was stressed about the idea of going back, how I would leave 3 young children for that long of a stretch at a time, and as you know well what it's like to work in the emergency room, I didn't feel like I could take a break for 15 minutes even once during a 10-hour shift to breast pump. And I felt like I really don't want to wean my newborn at 3 months from breastfeeding. So I had a lot of stressors going on besides the general stressors that we all feel about the harried environment, the understaffing, overuse of the emergency department, and the types of patients that sometimes get angry and with that situation and such.
Exactly. Did you have any fears about walking away from full-time clinical medicine?
I did. Everybody, if you ask anybody else, they all say, really? After all that training, you're thinking about walking away? Are you crazy? So definitely had that sort of fear about, well, what am I really thinking about doing? Would it be the wrong thing to do? How easy or difficult would it be to go back if, one walked away and changed one's mind? Definitely had a lot of questioning.
So how did you respond to people when they said, geez, Christine, you've wasted all that training. What are you thinking? How do you respond to that?
Well, I feel like the amount of training I had and the amount of practice I had in clinical medicine has been completely useful to what I do now, that I couldn't do my current job without training as a physician and without real practice. I feel like if you get a certain amount from doing medical school, but you get a whole nother aspect from residency, and you get a whole nother aspect of experience when you're really seeing people after training.
Obviously, transitioning away from medicine requires, a great deal of introspection, but also support from family and friends. Were your family and friends, what did they think when you announced that you were not going back into the trenches?
My husband has always been completely supportive, so that is key. I think my parents over the years have grown accustomed to my sudden surprising statements. For example, when I said I was going to leave my computer science PhD program to go to medical school, that was really? So I think by that time they've already gotten used to the idea that there were other things I had in mind, or that I knew what might be best for myself. Then there are people further away who say, are you still a doctor now? and things like that. Really, you're going to throw that all away? And I really don't see it as throwing it away. Like I said, it's just another phase on the continuum.
So when you were in computer science, did you view medical school as a way to gain new skills that would allow you to apply that to the realm of medicine blended with computers?
At the time, I didn't really start out that way. I was just finished with a bachelor's in computer science and was in a PhD program. Just started like the summer before graduate school would officially start. And I was working on my master's project at Hewlett-Packard Laboratories in Palo Alto. It's really the first time I had to sort of lounge around and have some free time. And I thought, wow, where am I headed? And I just didn't really see academia in computer science as a way to feel like I could really balance family and career well. And I happened to go to the Stanford ER that summer because of a problem with my foot was getting more and more painful for some reason at the time. Morton's neuroma, it turns out. And my eyes were open. I was like, wow, here's a career that you could do just on a limited basis, part-time, and really feel fulfilled helping people, and then just spend the rest of the time outside of the hospital. And that was my big aha moment, and I thought, well, I'm going to head towards medicine and work part-time afterwards.
Sure. I think that was one of the appeals that emergency medicine had to me initially, as I saw it as a way to be flexible with the schedule. And it was exciting, but after 14 years, it's no longer exciting, and it's certainly lost its luster. The nights, the weekends, the holidays have become ever more so painful. And so, what would you say to somebody who is on the other side of the fence, looking to get out of medicine, now that you have plenty of experience outside of medicine? What sort of advice would you give them?
I would say that you have to really just follow what your heart says you want to do. It's your life. You've got, whether it's a few years or many, many years of working, you have to enjoy what you're doing, and to dread each shift, or to have fear of each shift, or to be stressed out about it after each shift for days or weeks or months, is not the way that I wanted to live. And obviously we need physicians, so the people who don't have those types of stressors, that's awesome, because we need you working in the hospital. But for me and for other people who feel like that is really not what you want to do, there are other opportunities, and you just have to find them. And then, it's much more worth it to find and go through the effort of changing, despite what other people around you might be saying to dissuade you, so that you can feel really happy about what you do each day and look forward to it.
You touched on a few points that kind of pop into my head periodically. How long have you been away from clinical practice?
My daughter is 3.5, so 3.5 years.
Do you think you could walk into an ER right now and pick up and go? If you had to?
I wouldn't want to, but could I? I could probably muddle around. I think that you definitely get rusty when you don't use skills. And even after a 3-month maternity leave, I started feeling like, what were my favorite medications again for X, Y, and Z condition, and what were the doses that I prefer to use? You start to lose those details very quickly. Not the big picture of someone coming in with SVT or things like that, but what exactly was the alternate for Zofran at this hospital that doesn't carry that medication, or things like that.
I transitioned away from the emergency department for just a couple years. Just happened to fall into something that was much more family friendly. I have 3 kids, and my wife manages her own dental practice. And I certainly relate to the fears of going back. I've been back into the ER now for about 4 years, and yeah, you definitely lose skills rapidly, and certain things are terrifying, like the septic child that needs to be intubated and maybe an umbilical line. How often do we do that? Even in a busy center, and so that sort of is a terrifying. The other point I wanted to touch on is you mentioned, finding what else is out there. How would somebody go about finding an alternative to clinical practice? Obviously, you have to try and blend your passions and your talents. But when I talk to my colleagues who are trying to get out, they say, "I don't know anything but medicine. I couldn't do anything else but care for patients."
Well, one, you already touched upon the most important. What is it that someone likes to do besides medicine that you could combine with medicine? Whether it's writing, whether it's careful chart review, whether it's technology, working for a company from who working on medical devices, or working in completely different areas not related to medicine at all. Depends on one's own interest. But then I think that right now, with the amazing age that we're in with the internet, there's a lot online. If you search about non-clinical jobs, there are forums such as your own. For my particular area, there's a forum called MomMD that also speaks about clinical, non-clinical careers. I think a lot more people are so interested in the topic that you can look online and start to get ideas for what is out there.
Do you have any experience or know anybody who's talked to like a physician transition specialist? I know there's a few physicians that solely just work in helping other physicians transition out of clinical practice. Do you know anything about those type of services?
I don't know directly about those services, except for that at the time I was on maternity leave and thinking about considering leaving. I confided in this mentor of mine whom I love, and everybody, in fact, loves him, and he was at the Brigham and Women's, and he said that he had a dream of starting up exactly such a company to help people transition out. He actually mostly worked in a non-clinical job and then just did a few shifts on the weekends to support his kids. And tragically, he had an accident and died a couple summers ago, which was a huge loss to the entire community of people who knew him. But I would think that he wasn't the first person to think of such a job to help others get out of clinical practice.
I got a phone call a few months ago from the program director where I trained at Michigan State, and I was just shocked. He had told me that he's wants to get out of medicine, and had seen some of the blog posts I've written and some of the other things, and wanted to pick my brain and see if I could help him, which is interesting because I'm still relatively young in my career, that somebody with that much experience would reach out and sort of a moment of desperation and ask for help to get out. And it brings me up to my next point. There was just a recently released article about physician burnout. Do you think that it's a big a problem as the article states, between 50 to 60% of physicians would like to leave medicine now if they could?
I think it really is that big of a problem. Even though I mostly have anecdotal evidence to go upon, all the people I'm close to have left clinical medicine. A lot of them in the academic institutions, or one friend of mine has gone down to one afternoon per month, not in the emergency room, but in a different clinical field. And my closest friend from residency has just left within the past year. And we had already talked about the 13 co-residents we started out with, how half of them were no longer practicing in the emergency room.
Interesting.
And I really do think that in the way that clinical medicine is right now, the environment makes it so that it's very difficult for people to want to stay in it, which is, of course, a problem.
It's definitely going to be more of a problem. So for physicians, obviously we know what we do during the day. For someone who has never done anything else, it's a little bit of a mystery of what a typical day would be like for somebody who works in a non-clinical realm. What's a typical day or week like for you?
Okay, so first I want to say that mine is very atypical, but let's say I had a regular job as a chief medical officer. I might go to a technology company from 9 to 5, Monday through Friday.
Painful.
and I might telecommute a couple of those days. I personally, as a chief medical officer of a young mobile health monitoring company, have the luxury and really the good fortune of working from home I typically, and I don't work full time, except for weeks when that's necessary. Um, and it works both ways because the young company, saves the company money as well. So a typical day for me is I get up early. I don't set an alarm, but whatever time I might get up, 5 a.m., 3 a.m., 6:30 a.m., I work for somewhere between half an hour to 2 or 3 hours for my company. And then I get my kids ready for school. I bring them to school. I might stay at school for an hour doing volunteer work for a class project. Then I'll come home and work for another hour or two. That's where I have most of my teleconferences set up for work. And then I'll pick up my 3-year-old, bring her home to my nanny or my au pair, who will play with her in the afternoon while I get some more of my work done and maybe have another meeting. Then I'll pick up the boys who are 6 and 9 and take them to soccer or to Cub Scouts or things like that, and fix dinner and, have family time, dinner, stories, getting ready for bed and things. And then if I still have work to do, I'll get it done after they go to bed.
So if somebody were to meet you in an elevator, sort of what would your elevator pitch be about what you do? Do you consider yourself a business person, an entrepreneur, or is your identity that of a physician, or all of the above?
It's really all of the above. The company is focused on innovative monitoring devices for people who want to age in place, an electronic safety net, and it is exactly the area of my PhD work in graduate school, which actually did go back to the interface between computer science and medicine, getting back to your original question there. And so it actually takes advantage of all of my educational background. There are questions that come up that are purely clinical, and then there are discussions we have that really are purely computer science area, and then there is everything in between. And we work on, this is not obviously a terrible elevator pitch unless we're going 50 floors. But in any case, so it's everything from computer science to medicine, helping a company with developing this innovative product.
Did this company seek you out, or did you start this company?
No, the CEO, my boss now, had read my dissertation from MIT and contacted me to see if I would consult for the company. And I loved her idea. This was back in 2005, right when I finished residency. And so initially I was a consultant for the company, and I loved the work, and it's entirely from home, just a few hours a week or month. And as the years went by, I was increasing the consulting hours and decreasing shifts in the emergency room, so I didn't feel like I was working anywhere close to full time.
Gotcha. So how did you learn the business skills that go along with your current position? And is that something sort of you learned on the job, or did you have some previous business background to help you with your current role and duties?
Yeah, definitely on the job. So I go to investor meetings and things like that. It's all on the job because I don't have a business background.
Okay. One of the concerns that I hear a lot when I talk to physicians about leaving medicine, at least the clinical side, is walking away from a typical physician, full-time physician salary and going into the business world and starting at a much lower rate. Do you have any suggestions or advice when people are contemplating or maybe hanging on to the ER work just because of the income, even though they hate it? Do you have any advice for those type of people?
Well, I would say that where you find your passion in your career, that you'll be willing to put in the time and energy to do well at it, and the compensation will follow. I know plenty of physicians who are not in clinical medicine who have what seems like amazing salaries,
Sure.
With high positions, whether it's at a venture capital firm or positions in technology companies that are doing well and things like that. And yeah, we do have the luxury as clinicians to have quite good salaries. But I think that there are plenty of opportunities non-clinically as well, and I wouldn't let that be the factor that dissuades someone from doing something that they think they'll really love doing rather than dreading their job.
Sure. Do you do anything else? I saw that you're working on a writing project, a book project.
I am. In fact, I just finished my book proposal finally after 2 years.
Awesome. Congratulations.
Clearly on the side. And I'm working on a memoir about the seemingly unlikely transformation of a good girl, so to speak, from the Midwest into an ER doc. What that process about. It was really about the residency years. And I've been enjoying working on that. But I feel like for a lot of people not in medicine, it's a big eye-opener about residency. And for people who are in medicine, like this close friend of mine who just left also, she was flipping through and, you know, it's just, she was nodding her head and like, oh yeah, and like, just, you know, she just thought it was so cathartic to read what someone else had experienced to relate to her own experience of that time.
Sharing the pain. I think I have a few friends that are just now in medical school and residency, and they have it a lot better, but it's still painful. Would you do it all again? Would you go back and do it all again?
I would. I would. You know, I really feel like all of my experiences have contributed to where I am now, and that I couldn't have this sort of dream job balance between career and family that I have if I didn't have the background that I do. And so, yes, I would do it again.
So your book proposal, is this going to be published through a publisher or self-published, or where are you going to go with that?
I'm trying to go through a traditional publishing company.
Okay. Is it as difficult as you thought, or easier?
Well, I think that it's slower than I hope on both sides.
Yes.
You know, waiting for responses, but like I said, it took me a long time to get that official proposal done and things like that.
I had published a book last summer, and the same experience. It took almost close to a year to get the final process done and actually release the book through a publisher. And I was surprised that it became a little bit painful, where I just got a little tired of sitting down every night and looking at the same pages over and over again.
Yeah. And then also to answer your original question about what else to do on the side, I've just been dabbling in creating some iPhone apps, really because my husband had written some. I thought, wow, can you please write this and this and this? And I've got all these ideas. And he's like, no, I don't want to do any more programming. And while I have this computer science background, I don't have time to do it either. So I have a friend who, at the time, was laid off from a Silicon Valley company. And I said, here, I'll come up with the ideas. I'll write the specs. You do the programming. We'll sell and we'll share the profits. So we have one app out, and we're trying to get the second one out.
What's your app on? What's your app do?
The one that's out is called Rev It Up, and it simulates, this is from 2010, so it's a while back, but it turns your iPhone into a motorcycle grip so that you can hear it revving.
My kids would love that. I'll have to check that out. So, couple last questions and we'll wrap up here. Do you miss the excitement of the ER? Would you like to go back and do a trauma state case or run a code? Do you miss any of that stuff?
People often ask me if I miss working in the ED. I miss the nice patients, the nice family members, the ones who are really appreciative of taking care of their loved one and explaining to them what's going on. There's so many things I don't miss about the emergency room that, no, I wouldn't want to go back. And I didn't ever live for kind of the adrenaline rush of having some gory trauma or code come in. I really enjoyed seeing a person, figuring out what was going on, explaining to them, helping them feel better, that immediate satisfaction of helping someone improve, but not just to take care of traumas or codes. So I don't miss that. I still have a very close friend who works as a clinical assistant in the ER, and when she tells me weekly what she's seen, that's enough to just be constantly thankful that I'm not there.
I totally agree with you, and I tell my parents that I'm transitioning away, and I generally work maybe 1 day a week in the summer. They say, "Aren't you going to miss that?" And my take on it is, it's no longer exciting. I like to help people, but realizing that, geez, that's someone's dad, that's someone's brother. I don't, seeing the tragedy of the illness, I think it's just really starting to take a cumulative toll on my overall outlook in medicine, and I hear that a lot from my colleagues in the ER, that it's sort of certainly a factor in their burnout.
Right. And when I was looking a few months ago at some articles online, it said that physician burnout, physician attrition is around 24 to 25%. That's people who actually leave. Obviously, much higher the people who want to leave or thinking about leaving.
Right.
What you were saying, but a good quarter have actually left, according to these papers and articles.
Yeah, I think it's going to become more and more of a problem as the immediate years go by. Two last questions here. They're pretty similar. If you were going to address a residency class, would you give them any specific advice on things to consider as they transition away from residency into practice? And then what one tip would you give your best friend who's also a physician on getting out of medicine?
Well, I guess to the residency class is just that you need to focus on what brought you into medicine in the first place, taking care of the patients, and try to just not let the rest of the situation in clinical medicine get you completely down, so that you can still focus on the parts that you do like of medicine. And in terms of a friend who wants to transition out, really, again, what I said earlier is to listen to yourself. You're the one who's living your life, and you want to look forward to what you do each day, each week, for the coming weeks and years. You don't want to dread what you do. So listen to what you want to do and pursue it.
Great. Thank you, Dr. Silvers, for your time. This wraps up this week's episode, and we'll see you soon. I just got off the treadmill, so I'm a little bit haggard here. I worked in the ER all week, and so. But anyways, are you ready to get started?
Yep, sure.